Viberzi is a medication that is used to help treat a stomach and abdominal disorder called irritable bowel syndrome with diarrhea, also known as IBS-D. It works by slowing down the movement in your gut, which can help reduce symptoms such as belly pain and diarrhea. The usual recommended dosage for Viberzi is 100 mg twice daily, with food. It is important to take Viberzi exactly as prescribed by your doctor. The best time to take Viberzi is with your morning and evening meals. Be sure to follow your doctor's instructions and not to exceed the recommended dosage. Before you start taking Viberzi, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with food as directed by your doctor, usually 2 times a day. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Do not increase your dose or use this drug more often or for longer than prescribed. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. If you are also taking loperamide to help control diarrhea, do not take it on a regular schedule or you may become constipated. However, you may take it occasionally if needed for severe diarrhea. If you develop constipation, stop taking loperamide and tell your doctor right away. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Take this medication exactly as prescribed to lower the risk of addiction. Tell your doctor if you do not get better or if you get worse. If you experience constipation, nausea, vomiting, abdominal pain, or drowsiness while taking Viberzi, it's important to let your doctor or pharmacist know immediately. If you have severe constipation, stop taking aloxatilene and contact your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use Viberzi do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as symptoms of pancreatitis or sphincter of Oddi spasm, like nausea or vomiting that doesn't stop, or new or worsening stomach or abdominal pain that may move to your back or shoulder. While a serious allergic reaction to Viberzi is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, like rash, swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed here, it's important to contact your doctor or pharmacist. In the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Viberzi, it's important to discuss any allergies with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to inform your doctor or pharmacist about your medical history, especially if you or your family have a history of substance use disorder, have had gallbladder removal surgery, or have liver, kidney, or pancreas issues. Viberzi may cause drowsiness, and using alcohol or marijuana can intensify this effect. It's important to avoid driving or using machinery until you can do so safely. Limit alcohol consumption, and speak to your doctor if you use marijuana. Excessive alcohol consumption while taking Viberzi may increase the risk of pancreatitis. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Viberzi, particularly constipation or stomach/abdominal pain. If you are pregnant, Viberzi should only be used when clearly necessary. It's important to discuss the risks and benefits with your doctor. It is also unknown if Viberzi passes into breast milk, so consult your doctor before breastfeeding. When taking Viberzi, it's important to be aware of potential drug interactions. Certain medications may alter the way Viberzi works in your body or increase the risk of experiencing serious side effects. To ensure your safety, Keep a comprehensive list of all the medications and products you use, including prescription and over-the-counter drugs, as well as any herbal supplements, and share it with your doctor and pharmacist. It's crucial to never adjust the dosage or stop taking any medications without first consulting with your doctor. This will help to minimize the risk of any potential interactions and ensure the effectiveness of your treatment plan. If you suspect an overdose and the person is experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, you can contact a poison control center for guidance. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. It's important to remember not to share your Viberzi medication with others, as it is against the law. Your doctor may also schedule lab tests, such as liver function tests and lipase levels, while you are taking Viberzi. Be sure to keep all of your medical and lab appointments to ensure that your treatment is effective. If you forget to take a dose of Viberzi, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Viberzi, you should keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and always keep it in a safe place to prevent theft, misuse, or abuse. It's also important to keep all medications away from children and pets. When it comes to getting rid of Viberzi, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.